And the drug naming guy puts the words vigorous and Niagara together and he made... Hi friends, welcome back to my channel. My name is Aina and I am an oncology pharmacist. I work in Canada. And 20 minutes car ride away is the United States of America, a place where I fear for my life when I'm walking on the street after sundown. And they have pharmaceutical advertisements that are just so illegal in my innocent Canadian mind. For example, this first one.
Herb quit smoking with Chantix and support. Some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Chantix.
Okay, I already have so much to say about this. First of all, it's bizarre that in the States, this drug is called Chantix because we have the exact same drug here in Canada and it's called Champix, and they're both made by Pfizer. I've seen memes online where you just smash your keyboard and whatever comes up is a drug name, and sometimes I question if that's true. Like, who came up with the drug name mogamulizumab? Actually, maybe the drug inventor is the avid fan of the 1960 Bollywood classic Mogaliyazam. The amount of work that goes into naming a drug is insane. There's actually an organization called the Brand Institute, and they take years and years of work to come up with a drug name before it hits the market. Like for example, the drug name Viagra was invented when the drug naming guys went to the doctors and asked, "Hey, tell me what you visualize when a guy's ED goes away." And the doctor thinks about it and goes, "I imagine a very strong stream." And the drug naming guy goes home and he puts the words vigorous and Niagara together and he made Viagra. So I'm sure there's a reason why it's called Champix in Canada. Maybe we're just the real champions, you know?
If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away.
Sometimes the doctors actually get mad at pharmacists for telling the patients too many side effects about the drug that they got prescribed because they think we're scaring the patients. But like legally, we're required to talk about the common and the serious side effects to a drug. Like for example, telling patients they may get life-threatening low blood pressure when they take Viagra, or asking patients about their thyroid cancer history before we give out the Ozempic. I get that we don't want to list out every single drug side effect, otherwise we're gonna sound like these commercials, but we can't also just not say anything. What do you want from us, doctors? We're just doing our jobs.
Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people can have allergic or serious skin reactions to Chantix, some of which can be life-threatening.
Okay, that's an anaphylactic reaction.
If you notice swelling of face, mouth, throat, or a rash, stop taking Chantix and see your doctor right away.
Severe allergic or anaphylactic reaction can theoretically happen when you take any medication, so I guess they have to mention it. They can probably just reuse that same line in every single commercial they make.
Tell your doctor which medicines you're taking, as they may work differently when you quit smoking. Chantix dosing may be different if you have kidney problems. The most common side effect is nausea. Patients also reported trouble sleeping and vivid, unusual, or strange dreams. Until you know how Chantix may affect you, use caution when driving or operating machinery.
Whoa, hold on. These are actually some legitimately good advice. I mean, these are side effects I would talk to my patients about before they start Champix or Chantix. Because this drug helps to quit smoking, it works similarly to nicotine, so the side effects you can expect are similar to nicotine overdose, which can be nausea, insomnia, vivid dreams, and stuff like that.
Chantix should not be taken with other quit smoking products.
Wait, that's not true though. A lot of the times, Chantix is prescribed along with other quit smoking therapies, like nicotine patches. I actually also found the Canadian version of this drug advertisement, and compared to them, we're like babies.
So settle down, folks. We've got lots to cover in the agenda today. As you can see from our topic there, de-stigmatizing just top of mind awareness for the market. Probably because in the last few months, that's where we want to be, the very top of everyone's mind. But we're simply line sales in the markets. We're seeing more and more of an increase in repeat sales.
It helps to talk to a professional. Ask your doctor or pharmacist about Champix.
Yup, that's it. That's all they're allowed to say in advertisements. In Canada, the regulation is you can either only have the drug name or the disease this drug treats. You can't have both. That's why in this commercial, they can only show you the drug name and nothing else. Okay, I also found this Canadian commercial for Cialis, which is a drug very similar to Viagra.
Hey, Mom.
How's it going?
Good, I'm just doing this chem problem.
This is for you.
These are cool.
Why is the mom looking at him so weird?
Thank you.
I'll let you get back to your stuff.
Cialis. Ask your doctor.
Because Canadian pharmaceutical advertisements are so strict, the drug companies have to come up with another approach to market their drugs in Canada. They go directly to the source, which are the doctors. Now, kickbacks are obviously not allowed, but education sessions and presentations are. Big pharmas nowadays will actually hire scientists with master's or PhD degrees in pharmacology or pharmaceutical sciences, and they will actually try to establish a professional relationship with doctors. And instead of promoting the drug, they try to educate. And of course, especially if you have nice food or drinks involved, you can get your education points across much easier. The next drug company was sued in the largest lawsuit ever in history for big pharmas. They had to pay over $5.5 billion to settle their criminal charges, and they're one of the biggest contributors to the opioid crisis. This commercial was distributed to over 15,000 doctors in 1998 to show them how their drug, OxyContin, can improve patient lives.
There's a major misconception, I think, in the medical profession that pain treatment consists largely of pain management, and people seem to mean by that that you can only teach patients in pain to live with their pain. And so often I hear that back from the patients, that all the doctor could offer was help living with the pain. Well, that's not what pain treatment is. We don't treat diabetes or asthma by teaching people how to live with their diabetes and asthma.
What?
We treat the diabetes and asthma, that is, we shut it down as far as we can.
Wow, okay, so either chronic disease management has completely flipped on its head since 1998, or this doctor's just not giving the right information. When we talk about chronic diseases, whether it's asthma, diabetes, or pain, we always have to talk about management because the patient has to live with this condition. That's what makes it chronic. Let's face it, diabetes isn't going away. We can't just shut it down and you'll be diabetes free like what he's talking about here. The right expectation needs to be set for the patient, right? Like, how would you shut down chronic pain? I guess by the tone of this commercial, we'll just load up everyone on opioids, I guess. Future editing Ina here. I just forgot to explain that these clips are actually taken from two separate videos. One of them is the original 1998 commercial, and the other one is actually done almost 15 years later, a video to follow up on the patients and their families to see how they're doing now. So you'll see clips from both. Now back to the video.
I got my life back now. Now I can enjoy every day that I live. I can really enjoy myself. And before, even a good day was hell. I mean, I couldn't enjoy nothing. But now I can enjoy myself. That's when I say it's wonderful.
His biggest problem was he would sleep a lot. He'd be sitting in here talking like I'm talking and fall right off to sleep while he was talking.
The problem with opioid medications is that there is no ceiling dose. As your body starts to tolerate the dose you're on, you require a higher and higher and higher dose to manage the pain. With the higher dosage comes with higher side effects. So drowsiness and sleepiness is one of the most common side effects to opioids, right? That's why the addicts appear to be dopey and they're just drowsy all the time.
Since I've been on this new pain medication, I'm able to be very productive person again, which is really great.
You're gonna need more and more and more.
I think when I first started, I was on 20 milligrams in the morning and 20 in the evening.
That's already a pretty high dose, to be honest.
And it worked. It worked. It stopped working, and it got increased. I think it was 40 in the morning and 40 in the evening. This went on for years. Went on for years. I lost my job and I lost my insurance. So it got to the point where I couldn't afford it, and I didn't buy it one time, and that was the beginning of the end for me, because I could no longer afford it, but the time that I went without it, unbelievable, excruciating, horrible time of my life. The withdrawals were just unbelievable.
So I have first-hand experience seeing someone suffer from withdrawal. We actually help with addiction patients every day because they would be coming to pharmacies to take their daily methadone dose. And methadone is a prescribed opioid agonist treatment to help keep patients off the streets.
There's another serious misconception, and that's about the medicines that we use for pain. There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things.
Addictions and other terrible things? I like how he just brushed that off. Yeah, they're just terrible things, you know? You can just get respiratory depression and die, I guess.
Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%.
What? I don't trust that at all. Let's fact check this. Prescription opioid drug misuse. Well, this trusted source of reference that many clinicians use says that the estimated prevalence of opioid misuse among patients who are prescribed opioids vary widely from 12% to, shockingly, 78%. That's many, many, many times higher than 1%, okay, doctor?
They do not have serious medical side effects.
Really? Do you think respiratory depression or CNS depression are not serious side effects? For chronic pain, opioids are actually the last line of treatment. It has been proven that non-opioid medications are just as effective as opioid medications. Even like capsaicin, the spicy stuff that you find in peppers, is ranked higher in the pain management algorithm compared to opioid medications. I recently just made a video on capsaicin, so if you're interested, please check that out. There's really only one area of pain control where opioids are used, which is chronic cancer pain. Oof, I feel like my blood pressure just shot up in the last minute, so let's move on to something of a lighter mood. I can't actually believe this. There is a music video made by the drug company called Pharmaceutical for a drug called sepsis, which is fentanyl. Are these two guys supposed to be drug raps? How is this even real? Okay, this is funny because it's kind of true. They do like to come by doctor offices and bring lunch for the doctors and the staff, and they do like to host sponsored dinner talks where they promote their drugs. Yeah, sometimes being the pharmacist next door, I can smell how good the lunches are, but the drug reps typically don't bring lunch for me. Okay, I can't anymore. This is getting way too stupid. There is a person dressed up in what I can only assume is a sublingual fentanyl spray and rapping to this song. But I mean, the fact that we're still seeing so much money being dumped into making commercials like this must mean that this is working somehow. So I hope that was funny and infuriating to you as it was for me. If you like this video, please don't forget to give it a thumbs up and subscribe for more contents like this, and I'll see you in the next one. Bye!